Today, we'll be discussing about the respiratory system. The functions are to provide oxygen to and eliminate carbon dioxide from the cells of the body, filters, warm, and moisten the inspired air, produces sounds, contains receptors for smell, rids the body of some excess water and heat, and helps regulate the blood. Here is the picture where we can see the functions to supply the body with oxygen and remove the carbon dioxide. The first one is the external respiration or the external exchange. Dito nagkakaroon ng gas exchange between sa blood at sa air na nagsisirculate sa ating lungs. Next is the ventilation. The ventilation is the movement of air into and out of the lungs. Dito pumapasok, lumalabas yung air going through the lungs. Next is the internal respiration or the internal exchange. Ito naman yung systemic blood and the tissue cells. And the last is the transport of gases. Pero wala tayong makikitang gas exchange. So now, I'll be discussing the upper respiratory passageway consists of the nose and the pharynx or the throat. Let's proceed first to the nose. Air can enter our body through our mouth. Pero, hindi siya mafi-filtered kagaya ng nose na once na pumasok yung air sa ating katawan, nafi-filtered siya. So, the nose. The nose is the only externally visible part of the respiratory system, which is true. Nose lang yung nahahawakan natin, and the rest nasa loob na ng ating katawan. Functions. Providing an airway for respiration, moistening and warming air, filtering inspired air, and serving as a resonating center of speech. Let's talk about the first three functions of the nose. The epithelial cell. Ang epithelial cell, or commonly known as the nose hair, connecting with the mucous membrane, silang dalawa yung lined inside our cavities. Meaning, sila yung mga nagtatrap ng mga unwanted particles para ma-filtered yung mga air na pumapasok sa ating katawan. The air that enters through the nose, where it is warmed, filtered, and moistened, passes over the hair-covered mucous membrane of the nasal cavity. The sputum. Ang sputum ay ang mixture ng ating saliva at ng mucus na pwedeng magkaroon ng infection or pwedeng mag-cause ng infection or other diseases. Sputum is the material that eliminates the respiratory tract by coughing or cleaning the throat. Turbinate bones. It increases the surface area for heating. So, the cavities within bones surrounding the nasal cavity, like sinuses, is located sa frontal, sphenoidal, ethmoidal, and maxillary sinuses. At dahil malapit siya sa nose, tinawag itong paranasal sinuses. So, the functions are lighten the skull, act as resonance chambers for speech, and produce mucus that drains into the nasal cavity. So now, let's proceed to the pharynx or the throat. The pharynx, ito yung passageway ng ating food entering sa ating esophagus. Ito din ang passageway ng air to the larynx. At ang pharynx din ang funnel-shaped passageway na nagko-connect ng nasal cavity and mouth sa ating larynx at esophagus. There are three regions sa pharynx. The first one is the nasopharynx or superior region behind the nasal cavity. Meaning, ang nasopharynx, siya yung nasa pinakataas malapit sa nasal cavity. Siya din ang air passage. At ang nasopharynx din ay tinatawag na auditory tube. Ano ba pag sinabing auditory tube? Ang auditory tube, ito yung naglilink ng nasopharynx sa ating middle ear. The next one is the oropharynx. The oropharynx is the middle region behind our mouth at siya ay common passageway ng air at ng food. And the last one is the laryngopharynx. Siya naman yung inferior region attaches to larynx at kagaya ng oro, ito din ay common passageway ng air at ng food. Let's look at this structure of the pharynx. Makikita natin dyan ang tonsils, pharyngeal tonsils, palatine tonsils at ang lingual tonsils. So, bakit nga ba tayo nagkakaroon ng tonsillitis? There are two ways kung bakit tayo nagkakaroon ng tonsillitis. The first one is the viral causes, like cold viruses, HSV or the herpes simplex virus, and the measles. The second one is the bacterial causes. Nandito na yung medyo malala na, like Staphylococcus aureus. Ito yung most dangerous sa lahat. Next is the whooping cough, yung severe na yung hacking cough mo. Next is the strep throat. Dito mo na mararamdaman yung sore and scratchy na, at pwede ka rin magkaroon ng complication like kidney inflammation. So what are the symptoms of having a tonsillitis? The first one is the bad breath. Next, painful swallowing. At kapag nararamdaman mo na nahihirapan ka ng lumunok, nawawalan ka na din ng gana kumain. Next is the sore throat and change in voice. So, ano ba yung pwedeng treatment na pwede nating ibigay kapag nagkakaroon ng tonsillitis ng isang tao? Kapag hindi pa masyadong malala, ang laging sinasabi sa atin, mag-gargle ng water with salt. 1/2 tablespoon of salt and 4 ounces of warm water. Pero kapag dumating na sa point na malala na yung tonsillitis mo, nagkakanana na, sobrang pula na, or lumalaki na, consult to your doctor. Or, based on my research, pwedeng magpainom ng penicillin. But for the safety, magpa-consult na sa doctor. So, that is it for the upper respiratory passageway, consists of the nose and the pharynx.
Upper respiratory passageways and lungs. Air moves from the pharynx to the larynx, commonly called as the voice box, because it contains the vocal folds or cords. Larynx is at the top of the trachea, which is commonly called as the windpipe, which conducts air into the bronchial system toward to the lungs. The larynx, shaped by 9 cartilages, most prominent of which is the anterior thyroid called cartilage that forms Adam's apple. Small leaf-shaped cartilage at the top of larynx is called epiglottis. When one swallows, the epiglottis covers the opening of the larynx and helps prevent food from entering to the respiratory tract. Larynx contains the vocal folds, bands of tissues that are important in speech production. Vibration produced by air passing over the vocal folds form the basis of the voice reproduction. The opening in between the vocal fold is the glottis. Epiglottis is above the glottis. The trachea is a tube reinforced with C-shaped rings of cartilage to prevent its collapse. Feel the trachea, or you can feel these rings if you press your fingers gently against the front of your throat. Cilia is the trachea's lining move impurities up toward the throat. They can be eliminated by swallowing or expectoration or coughing. Trachea is in a region known as the mediastinum, which consists of the place between the lungs together with organs contained in this space. It means if this is the lungs, then the trachea is in here. The trachea and the mediastinum contains the heart, esophagus, large vessels, and other tissues. Bronchial system. As it lower ends, trachea divides into a right portion and the left portion. Left and right primary bronchus which enter the lungs. The right bronchus is shorter and wider, divides into 3 secondary bronchi is the right lung. The left bronchus divides into 2 branches that supply the left lung. Further divisions produce an increasing number of smaller tubes that supply air to smaller divisions of lung tissues. As the air passageways progress through the lungs, cartilage in the walls disappears and replaced by smooth muscles. Smallest of the conducting tubes, the bronchioles, carry air into the microscopic air sacs. The alveoli, through which gases are exchanged between the lungs and the blood, is through the ultra thin walls of the alveoli and surroundings that carries oxygen diffuses in the blood for elimination. The lungs, cone-shaped lungs, occupy the major portion of the thoracic cavity. Right lung is larger and divided into 3 lobes. Lobes are further subdivided to correspond to divisions of the bronchial network. A double membrane, the pleura, covers the lungs and lines the thoracic cavity. There are 2 pleural layers. First one is the parietal pleura, outer layer attached to the wall of thoracic cavity. Second one is the visceral pleura, inner layer attached to the surface of the lungs. The very narrow fluid-filled space between 2 layers is called the pleural space. The moist pleural membrane slide easily over each other within the chest cavity, allowing the lungs to expand during breathing.
So, alam po naman siguro natin ng breathing, no? Kasi for sure po, lahat po tayo humihinga. So, breathing po, air is moved into and out of the lungs by the process of breathing, technically called pulmonary ventilation. Is normally regulated unconsciously by centers in brainstem. So, sa Tagalog po ay normal na kinokontrol sa pamagitan ng sentro sa brainstem. So, ano nga ba yung brainstem? Base po sa research ko ay brainstem is a distal part of the brain that made up of the midbrain, pons, and medulla oblongata. So, may papanood po akong konting video para po malaman natin kung paano ang tamang paghinga, para po malaman ang tama at mali. So, let's watch.
Take a deep breath. If you feel like you're going up and getting a little bit taller, you're breathing so wrong. Breathing wrong is when you use your neck and shoulders to pick up your thoracic cavity. So do this now. Take a deep breath and watch. If you feel like you're going up and getting a little bit taller, and then you come down and settle down on your exhale, that's actually a dysfunctional breath. At 5 and under, I've found that most kids breathe perfectly. So a number of things happen so that when you ask a 10-year-old to breathe, they start breathing with that upper body breath that's actually anatomically incongruous and leads to us being in fight and flight, more anxious, having neck and shoulder pain, not being able to sleep, and having digestive problems. So how did we get there? Number 1 is that child starts sitting a lot. They start going to school. We sit way too much, 13 to 16 hours a day. Number 2 is injuries. If you're a little kid and all of a sudden you start skateboarding or skiing, anything that hurts the middle of your body, you immediately stop inhaling and expanding because it hurts. And your breath goes all the way up here to be an upper body or a vertical breath. You start wearing waistbands, bra straps, compression garments. You start sucking in your gut, and all of a sudden that breath that was perfect before you were 5 turns into a dysfunctional one as an adult, and it stays there until you fix it right now. A good breath, a breath that's anatomically congruous, it goes with the rest of your body, is that you inhale and you expand your body. Neck and shoulders don't move. You expand all the way around, 360 degrees. You come forwards a little bit, your sides open up, and even your back opens up. And if you want to see what this looks like, look at your dog, your cat, your fish, any animal on the planet except for us, and you'll see them breathe perfectly, 360 degrees all the way around, expanding on the inhale and contracting, wringing out, getting narrower on the exhale. No neck and shoulder movement.
Gas transport. Oxygen is carried in the blood bound to hemoglobin in the red blood cell. Hemoglobin is the iron-containing pigment in the red blood cells that transport oxygen. The oxygen is released to the cells as needed. Carbon dioxide is carried in several ways but is mostly converted to carbonic acid. Carbonic acid is an acid formed when carbon dioxide dissolves in water. The amount of carbon dioxide that is exhaled is important in regulating the blood's acidity or alkalinity based on the amount of carbonic acid that is formed. Dangerous shifts in blood pH may result from exhalation of too much or too little carbon dioxide.
So, good morning everyone. I am Shara Pizzi Lagos from BSRT1A, and I am here to present to you about the parts pertaining to the respiratory system. So, let's start to the suffixes for respiration, which is neia, means breathing, and example of this is dyspnea, which means shortness of breath, painful or difficult breathing. And next is OSHA, which means level of oxygen, and example of it is hypoxia, which means is the decreased amount of oxygen in the tissue. Next is capnia, which means level of carbon dioxide, and example of this is hypocapnia, which means decrease of carbon dioxide in the tissue. And next one, and the last one is deponia, which means the voice, pertaining to the voice. An example of this is aphonia or loss of voice. So when we're referring to the level of oxygen and carbon dioxide in our blood vessel, the suffix emia is used as in hypoxemia and hypercapnia. Next, let's go to the roots for the respiratory passageway. So the root means on naso in combined form, meaning is the nose, and the example of this is intranasal, which means within the nose. So the next one is rhino, or rhine and rhino in combining form, which means also in the nose. An example of this is rhinoplasty, which means plastic is referring to the plastic repair or surgery, and rhino's nose. So the definition of example is plastic repair of the nose. Next is pairing or pharyngeal in combining forms, and the meaning of this is pharynx. Then the example of it is pharyngeal, which means pertaining to the pharynx. Next one is larynx or laryngo in combining form, and its meaning is larynx. An example in the table is laryngospasm, which is spasm means is the sudden contraction. So laryngospasm means sudden contraction of the larynx. Next one is the tracheae or trachea in the combining form, which means pertaining to the trachea. And the example is tracheotomy, and the definition of it is instrument used to incise the trachea. The next one is bronch or bronchio in combining form, and bronchi in combining form, which pertain to our bronchus. Then the example in the table is bronchogenic, which means genic means origin or originating. So the definition of example is originating in the bronchus. And the next one is bronchiole. So it's mean to the bronchiole, and the example given in the table is bronchiolectasis. So it means the dilation of the bronchioles. So let's go to the next one, which is the root for the lungs and breathing. So let's go to the root. First root, pren or preno in combining form, which means the diaphragm. So example of this is phrenic. So the example, the meaning of phrenic is pertaining to the diaphragm. Next is phrenic or phrenico in combining form, which means phrenic nerve. So the example in the table is phreniectomy. So which means ectomy is incision. So phreniectomy means partial excision of the phrenic nerve. So pleura, which an example is pleurodesis, is fusion of the pleura. Next is, let's go to the pulmo in combining forms, and pulmon or pulmono in combining form, which mean lungs. So the example in the table is extrapulmonary, which means the definition of the example is outside the lungs. Next, pneumon or pneumono in combining forms is also meaning is lung. So the example in the table is pneumonitis means inflammation of the lungs, and pneumonia. So next one is pneum or pneumo and pneumato. So means pertain to the air, gas, respiration, and lungs. So the example in our table is pneumothorax, which means the definition of the example is the presence of air in the thorax. So it's called pleural space. So the last one is spire or spiro, which breathing also. So the example in our table is spirometer. So spirometer is an instrument for measuring our breathing. So that's all with regards to the table that pertaining to our respiratory system. Thank you.
Now we have already been discussed the introduction and how the respiratory system works in our body. Let us move on to the disease or disorders that affects the human body. Here are the clinical aspects of the respiratory system. Any disorder that causes resistance to airflow to the respiratory tract or limits chest expansion will affect pulmonary function. Ibig sabihin, kung ano man yung mga naging hindrance at nakaka-apekto sa paghinga ng isang tao ay nagkukos ng pulmonary infection or nagiging hindi maganda ang respiratory system ng isang tao. These disorders may involve the respiratory system directly, such as infections, injury, allergy, aspiration of foreign bodies, and cancer. Like for example sa infections, pag naka-inhale ng tao ng pathogens, nagkokosto ng disorders sa tao. Kasi yung pathogens, nagbibigay siya, biniweak niya yung respiratory system ng tao. Now, sa injury, once na madamage yung lungs natin, nagkokosto ng malfunction, then allergy, then aspiration of foreign bodies. As noted above, changes in ventilation can affect the blood's pH. It can be acidity or alkalinity. If too much carbon dioxide is exhaled by hyperventilation, the blood tends to become too alkaline, a condition termed alkaliosis. If too little carbon dioxide is exhaled as a result of hypoventilation, the blood tends to become too acidic, a condition termed acidosis. These two can cause severe or chronic illness in the pulmonary system. Now let's move on to the infections. There are many microorganisms or pathogens that can affect the respiratory system of humans. Like kagaya ng napapanahon ngayon, which is the COVID-19, that is from Wuhan, China, and acquired from the bats. The virus called is Severe Acute Respiratory Syndrome Coronavirus 2. It was derived from the SARS coronavirus way back in 2003. Unfortunately, the virus has no vaccine nowadays, and it can be asymptotic or symptotic, and it is fatal to those who have low immune system. Pero hindi lang coronavirus ang maaaring maging illness ng mga tao. Meron din kagaya ng pneumonia, tuberculosis, influenza, common cold, at marami pang ibang respiratory illness. Now let's move on to pneumonia. Ang pneumonia ay tinatawag na inflammation of the lungs, kung saan yung air sacs niya ay nafe-filled with fluid. At ang pneumonia ay maaari mong makuha through community, nosocomial, or sa hospital, at may tinatawag tayong aspiration pneumonia, kung saan may isang bagay kang nakain at hindi siya na-secrete out ng lungs mo, at yung pagkain na kain mo ay infected by virus or bacteria, it will give bad effects to the alveoli of the lungs. Now, there are two types of pneumonia, which are the lobar pneumonia at saka bronchopneumonia. The lobar pneumonia is an acute disease, involves one or more lobes of the lungs. Samantalang ang bronchopneumonia or the bronchial pneumonia occurs throughout the lungs. It begins in terminal bronchioles that become clogged with exudate and form pellucidate solidified patches. Pneumonia can usually be treated successfully in otherwise healthy people. But in debilitated or yung mga taong mahihina ang resistensya, it is leading cause of death in compromised patients such as those with HIV or AIDS are often subject to form of fungal pneumonia called pneumocystic pneumonia. The term pneumonia is also applied to non-infectious lung inflammation such as that caused by the asthma, allergy, or inhalation of irritants. In these cases, however, the more general term pneumonitis is often used. Now let's move on to the tuberculosis. Tuberculosis has increased in the recent years, along with the increase of AIDS and other fatal diseases like malaria. In the survey I have read, tuberculosis na nagtatap kung saan madami siyang napapatay na tao, mas malala pa siya sa AIDS at saka sa malaria. Ang bakterya na nakakahina sa system ng tao ay tinatawag na Mycobacterium tuberculosis. It also called as the AFB or the acid-fast bacillus. The name tuberculosis comes from small lesions or tubercules that characterize the infections. The tuberculous can be liquefied in the center, then ruptured to release bacteria into the bloodstream. Generalized TB is known as the miliary tuberculosis, caused by many tubercules and the size of millet seeds in infection tissues. Now, these are the symptoms of tuberculosis. It includes fever, weight loss, weakness, cough, hemoptysis, or the coughing up of blood containing sputum. Pero may mga paraan para malaman natin na isang tao ay may tuberculosis o wala aside from the symptoms. Pwede tayong mag-test kagaya ng tuberculin test, a skin test, also known as the Mantux. The test material, tuberculin, is made from byproducts of tuberculosis organisms. PPB is form of the tuberculin commonly used. The next one is the IGRA or a rapid blood test to diagnose TB. And then the NAA, a sputum test that can confirm a positive TB diagnosis within 24 hours. Ang kalimitang ginagamit ng mga TB patient or ng mga doctor sa mga TB patient are the BCG vaccine, kung saan ginagamit to worldwide para ma-prevent ang TB. But in United States, it is not commonly used because the incidence of TB in this country is relatively low and also because of the invalidates of tuberculosis tests. Now, the third respiratory illness is the influenza virus, or also known as the flu. It is a viral respiratory disease associated with chills, fever, headaches, muscular aches, and cold-like symptoms. During 1918, may isang kumalat na infections at tinawag siyang Spanish flu. Yung virus na nakikita dun sa Spanish flu is the H1N1 virus, and it affects more than 3% of the population of the world during that time. The influenza virus ay pwede mo makuha through droplets kung saan yung taong kausap mo ay meron palang influenza, madali ka niya maapektuhan once na ma-acquired mo yung droplets na galing sa kanya. Meron itong tatlong uri ng type. Meron type A, type B, type C. Kung saan ang type A ang pinaka-severe. It also can acquired by humans and animals. Samantalang ang type B, less common siya at only humans can be affected. Then the type C, the person who can be affected are the humans and the pigs. They are further designated H and N with numbers such as H3, N2, and H5N1. The H and N represent most surface proteins that the virus used to infect a host. Medical personnel combat influenza with vaccines, isolation of infected population, destruction of infected animals, and antiviral medication.
Common cold. More than 200 viruses are known to cause the common cold. The one half of these are rhinoviruses and the others include adenoviruses and coronaviruses. Like today's pandemic, the novel coronavirus. The symptoms are known to all. These are sneezing, acute rhinitis, tearing of the eyes, and congestion. The infection may spread from nose and throat to sinuses, middle ear, and lower respiratory tract. Cold viruses are mostly spread by airborne, virus-filled droplets released by infected persons, coughs, or sneezes. Frequent hand washing and not touching hands to any part of the face are good preventive measures. Common cold usually revolves about a week. Because it is caused by viruses, antibiotics do not cure them. Rest, drinking water, symptomatic treatment, and time work best. The large variety of viruses and their frequent mutation have prevented development of an effective vaccine. Emphysema, a chronic disease associated with overexpansion and destruction of alveoli. The common causes of this disease are cigarette smoke exposure and other forms of pollution, such as the smoke of the vehicle, in the factory, as well as chronic infection. Emphysema is the main disorder included under the heading of chronic obstructive pulmonary disease or COPD. Other conditions included in this category are asthma, bronchiectasis, and chronic bronchitis.
Alam po naman siguro natin kung ano yung asthma kasi asthma is common in children. Pwede din naman po sa matanda. At may mga pamilya po tayo or kaibigan na may ganito. So, asthma. Asthma is long-term disease of lungs. Asthma attacks result from the bronchial tube. So, yung bronchial tube po ay ito. Yan po. So, this constriction along with edema of the bronchial linings, inflammation, mucus accumulation result in wheezing, extreme dyspnea, and cyanosis. Dyspnea. This is difficulty dyspnea is difficulty in breathing. Although its causes uncertain, a main factor is irritation caused by allergies. So, treatment of asthma includes removal of allergens, administration of bronchodilators to widen the airways. So, bronchodilators are medications used to dilate the lungs airways, and they contain type of drugs known as beta antagonists. And the last is administration of corticosteroids to reduce inflammation. Asthma affects the airways. So the following symptoms are coughing, breathlessness, chestiness, and wheezing. So wheezing is the highly sound while breathing. There are two main types of inhalers, prevent inhalers and relief inhalers. Prevent inhalers is which you can take every day to help prevent symptoms for carrying off for the long term, while the relief inhalers which you use to immediately relieve symptoms as when needed. Bibigyan ko po kayo ng simple steps to avoid asthma. First is avoid smoking, keep fit and healthy, track your symptoms, and take medication correctly. And the last is regular checkups. So, sana po makatulong.
Pneumoconiosis, chronic irritation and inflammation caused by the dust inhalation. This is an occupational hazard seen mainly in people working in mining or stoneworking industries. Different forms of pneumoconiosis are named for the specific type of dust inhaled. For example, silicosis, anthracosis, asbestosis. Although the term pneumoconiosis is limited to condition by inhalation of inorganic dust, lung irritation may also result from inhalation of organic dust such as textiles and grain dust. Lung cancer is the leading cause of cancer-related deaths both in men and women. Incidence of lung cancer has increased steadily over the past 50 years, especially in women. Smoking cigarettes is a major factor not just in lung cancer but in different types of cancer. Most common form of lung cancer is the squamous carcinoma, originating in the lining of the bronchi. Lung cancer cannot be detected early as it metastasizes quickly and the overall long-term survival is low. Method used to diagnose lung cancer includes radiographic studies, computed tomography or CT scan, and sputum examination for cancer cells. Physicians can use bronchoscope to examine the airways and to collect the tissue samples for study. May also take samples by surgical or needle biopsies.
So, good morning. Let's go to the topic of respiratory distress syndrome. So, what is RDS or respiratory distress syndrome? RDS is a disease most commonly seen in premature infants with a decreasing significance of 37 weeks gestational age. So, due to the deficiency of pulmonary surfactant in the immature lung. So, what is pulmonary surfactant? So first, pulmonary surfactant is a mixture of lipid and protein. So what is the function of pulmonary surfactant? So pulmonary surfactant function reduce the surface tension at the air liquid interface to lungs or the alveolar. So pulmonary surfactant help to avoid the atelectasis. Let's continue. Not all infants may appear ill immediately after the birth, but if RDS is untreated, they will progressively worsen over the first 48 hours of life. So, paano ba natin malalaman na ang infant ay may RDS? Some cases, nakikita siya agad sa newborn screening. So, let's go. What is the symptoms of RDS? Here are the symptoms of RDS. Dyspnea, nasal flaring, grunting, retraction, and genosis. But most common is the grunt. Next, RDS X-ray finding. Low lung volumes, diffuse ground glass appearance with airborne. This one. So, as you can see, RDS is less common and less severe. So, all neonates at risk for RDS should receive respiratory support that reduce alveolar atelectasis or CPAP. And if persistent severe respiratory distress is noted, infants are incubated and surfactant is given via the endotracheal tube. This one is the endotracheal tube. Please. So, let's go to the next topic. So, acute respiratory distress syndrome, or also called RDS. Sorry. So, what is ARDS, or acute respiratory distress syndrome? Is a sudden and progressive form of acute respiratory failure, in which the alveolar capillary membrane become damaged and more permeable to intravascular fluid, resulting in a severe dyspnea, hypoxemia, and diffuse pulmonary infiltrates. So, respiratory distress syndrome is also a life-threatening lung condition that prevents enough oxygen from getting into the blood. Was first described. was first described in 1967 by Ashbach and his college. So, RDS is also referred with a variety of terms. It is most commonly called shock lungs, but it is also stiff lung, wet lung, post-traumatic lung, adult respiratory distress syndrome, adult hyaline membrane disease, capillary leak syndrome, and congestive atelectasis. So what is the etiology and risk factor? So here is the direct lung injury. Under this is the common cause, which is the aspiration of gastric contents or other substances, and viral bacteria pneumonia. So what is the less common cause? Here are the chest trauma, embolism, hot air, and amniotic fluid, inhalation of toxic substances, near drowning, oxygen toxicity, radiation pneumonitis. Here are also continuation of etiology and risk factor, which is the indirect lung injury, which have the common cause, which is sepsis, severe traumatic injury. So here are also the less common cause, which is acute pancreatitis, anaphylaxis, prolonged cardiopulmonary bypass surgery, disseminated intravascular congelation, multiple blood transfusion, narcotic drug overdose, non-pulmonary systemic disease, severe head injury, shock, and massive blood transfusion. So here are the clinical manifestation, or which is the early sign or symptoms that you will observe and you will feel. Here are the restlessness, dyspnea, low blood pressure, confusion, extreme tiredness, change in patient behavior, mood swing, disorientation, change in LOC. If pneumonia is causing RDS, then client may have also the cough and fever. While although we have the early sign, we also have a late sign and symptoms. So what this is, we have severe difficulty in breathing, like a labored, rapid breathing, shortness of breath, tachycardia, cyanosis, blue skin, lips, nails, like that. Then thin sputum, metabolic acidosis, and abnormal breath sound like ragas. Yung parang bang may nabara. Ganon. Next one, diagnostic evaluation. So here are the yung mga gagawin. So first is the history of above symptoms. So meron tayong on physical examination, yung auscultation, reveal abnormal breath sound. So the first done are the arterial blood gas analysis, then blood test, chest x-ray, bronchoscopy, sputum cultures and analysis. So other tests are chest CT scan and echocardiogram. So, So we have complication. So ano nga ba yung mga complication na na makikita natin sa RDS. So ito yung mga common complications. So here are the nosocomial pneumonia, barotrauma, renal failure, and other complication is like what I said earlier, is the oxygen toxicity, stress ulcer, trachea ulceration, blood clots leading to the deep vein thrombosis, and pulmonary embolism. So next, medical management, other medical management. Persons with ARDS are mostly hospitalized and require treatment in an intensive care unit. So no specific, also we don't now have a specific therapy for ARDS exists, but we have supportive measurements. So what is it? Under this is we have supplemental oxygen, mechanical respirator, positioning strategies, yan, mga x-ray, mga rad tape, yan, gumagawa ng mga positioning strategies. What is the positioning strategies that we can do? Turn the patient from supine to prone. The other one is, another position is the lateral rotation therapy. And we also have last, the fluid therapy. So, under medication, we have antibiotics. Next is anti-inflammatory drug, such as corticosteroids, then diuretics, drug raise blood pressure, anti-anxiety, muscle relaxer, and inhaled drugs, which is bronchodilators. So let's go to the cystic fibrosis. What is cystic fibrosis? Cystic fibrosis is a genetic disorder in the lungs, but also in the pancreas. So cystic fibrosis is CF for sure. So what is cystic and fibrosis? Cystic means fluid-filled sac, and also fibrosis is excess connective tissue that can infiltrate into the organ. So the cystic fibrosis is a autosomal recessive disorder. So under this we have CFTR gene, which C stand for cystic, F stand for fibrosis, T stand for transmembrane conductance, and R for regulator. So this is also CFTR protein. So because cystic fibrosis is autosomal recessive, you need to inherit the CFTR gene from mom and your dad. So there are tendency na wala sila, but they will be the carrier. So mostly cystic fibrosis was manifested in European descent. So here are the illustration. So CFTR pumps the chloride ion into the secretion. So it helps that chloride draws in water, so it will be cleaned out. So if the mutation, which is delta F508 of N100H, delta means deletion, F for phenylalanine, 508 is amino acid. So 508 amino acid over the 1480 phenylalanine is deleted or missing. So because of that, the delta 508 is misspelled. So this. So, hindi makakapasok yung chloride ion into the secretion. So there will be no water and it will be thick. Next. So later in childhood, cystic fibrosis can cause lungs problem. So here are cilia, a hairy light, helps to keep the airways clear of mucus and dirt, allowing us to breathe easily and without irritation. So here are the example of mucus. So yeah, if the mucus is thick, tendency magi-stuck lang siya. So the bacteria will colonize this. So the ciliary or the mucociliary action will be defective. So because of the, sinabi ko nga na, increase of bacterial load or the bacterial colonization in cilia part, they will be having symptoms of cough and fever and will be having changes on chest X-ray, which need the antibiotics. So antibiotics, So this one is a CF exacerbation, which is the example is pneumonia, and pneumonia needs the antibiotics. Next. So here are the problematic bacteria. First is Staphylococcus aureus, is the gram-positive, and then Pseudomonas aeruginosa, which is the gram-negative. It is hard to treat if antibiotic is resistant. So because of that, bacteria also creates their biofilm, which is matrix of life. So because of that, tatalbog lang sa aming immune system and antibiotics. So hindi mawawala sila. Next, others that is chronic bacterial infection, which is the inflammation of bronchiolitis, which is the wall damage and dilation. So meron din tendency na if the inflammation happens, they will be having a coughing of blood. So diagnose, it is what cystic fibrosis is diagnosed through increased amount of sodium and chloride in the sweat, and genetically identify the gene that causes CF by DNA analysis. Kasi nga, cystic fibrosis is genetic disorder. So there are no cure for the present CF. So walang cure, walang medicine, but patient are treated to relieve their symptoms like postural drainage, aerosol mist, bronchodilators, antibiotics, and mucolytic, which is mucus dissolving agents. So that's it for cystic fibrosis.
Now, let's talk about the sudden infant death syndrome or the SIDS, or most commonly known as the crib death. Bakit ba nagkakaroon ng SIDS ang infant baby, or ano ba yung mga causes na pwedeng maka-affect sa kanila para magkaroon ng SID ang isang infant baby? There are many factors na pwedeng maging cause, but I'll be discussing 2 factors that cause SIDS. The first one is the physical factors. It includes the first, brain defects. Kalimitan sa mga infant babies, pinapanganak na may problem sa utak at may portion sa brain nila na nagkocontrol para maka-breathe or maging awake. But the problem is, hindi pa mature yung kanilang brain para mag-work ng maayos. And the next one is the low birth weight. Dahil premature yung bata, meaning mas lalong hindi pa mature yung kanyang brain para mag-work properly. Next is the respiratory infection because of cold. Kaya karamihan sa mga infant babies ay nakaka-experience ng SIDS. The second factors ay ang risk factor, including sex. Kalimitan sa mga infant babies, boys ang more likely na mamatay sa SIDS. Next, age, race, family history. Yung family history, kung meron kang kapatid, kung meron siyang kapatid, pinsan, or kamag-anak na may SIDS, possible na magkaroon din siya ng sakit na yon. Next is the second hand smoke or being premature. So how to prevent? First one is back to sleep. Make sure na yung baby nyo ay kapag natutulog, hindi siya nakaside or yung tinatawag nila na sleeping on the stomach. And make sure na gagawin ito sa kanyang first year of life. The second one is keep the crib as bare as possible. Meaning, lagi mong titingnan kung malinis, maayos yung crib ni baby and comfortable siya kapag matutulog. And walang pakalat-kalat na toys and even yung mga alagang animals. Kasi pwedeng makaapekto yung mga animals, yung kanilang mga balahibo sa paghinga ng isang bata. And last is don't overheat your baby. So now, let's proceed to the pleural disorder. Ano ba yung pleural disorder? Or the pleura is the thin membrane that lines the surface of your lungs and the inside of your chest wall. When you have a pleural effusion, fluid builds up in the space between the layers of your pleura. So, ano ba yung mga causes para magkaroon ka ng pleural disorder? The first one is the leaking from other organs. Especially kung may sakit ka sa puso or yung tinatawag nilang congenital heart failure, na dapat siya yung nagpapump ng blood sa ating katawan. And also, pwede ka rin magkaroon nun kapag meron kang liver or kidney disease. Second one is the infections. Pwedeng magkaroon ka ng pleural disorder kung ikaw ay may pneumonia or tuberculosis. So, madami pang pwedeng maging cause ang pleural disorder. But I'll stop there and let's know more about pleural disorder. When air and gas collects in the space, the condition is called the pneumothorax, na pwedeng maging cause ng chest injury, lung disease, rupture air blisters, and mechanical ventilations. At kapag naman nag-collapse yung lungs, tinatawag itong atelectasis. So, ano ba ang pinagkaiba ng dalawa? A collapsed lungs happens when air enters the pleural space, the area between the lungs and the chest wall. If it is the total collapse, it is called the pneumothorax. Pero, kapag yung only part lang ng lungs ang naapektuhan, ito naman ay tinatawag na atelectasis. So, there are other materials accumulate the pleural space like hemothorax or yung sa blood, or hydrothorax, ito naman yung sa fluid. Yung thoracentesis, ito naman yung needle puncture of the chest to remove fluids or fusion na nasa pleural membrane. At yung tinatawag na pus, also termed as the pyrothorax. So that is it for the SIDS or the crib death and the pleural disorder.
Yung narinig na natin, yung mga iba't ibang uri ng sakit sa respiratory, this is how we diagnose respiratory disorders. Unang-una is the chest x-ray, CT scan, and MRI. Thanks to Roentgen, he discovered x-rays and we can easily see the infections in our human body. Sa CT scan, mas detailed siya compared to the chest x-ray dahil makikita na natin to in 3-dimensional. While in MRI, less radiation siya kasi gumagamit tayo ng magnetic compared sa other two. There are also other types on how to diagnose the respiratory disorders. Like bronchoscopy, kung saan may ini-insert na tube yung doctors para makita nila kung anong meron sa loob ng lungs ng isang tao. Then the other one is the thoracentesis, kung saan may ini-insert silang needles dun sa lower portion ng ribs natin or dun sa part na may pleural effusion or may tubig sa baga yung isang tao at dinidrain yung water inside the lungs. Then the other one is the arterial blood gases or ABGs. Ginagamit siya to examine the level of the oxygens and carbon dioxide sa dugo natin. Then gumagamit din tayo ng pulse oximetry sa pamamagitan ng oximeter kung saan measure natin ang oxygen level natin. Ito yung inilalagay sa daliri pag nagpapamedical tayo, yung parang clip na ginaganon sa daliri. Then the other one is the pulmonary function test. It is used to assess how lungs are working. Gumagamit tayo para ma-assess yun usually by the means of the spirometer. The measure the volumes of air that can be moved into or out of the lungs with different degrees of effort, often used to monitor treatment in cases of allergy, asthma, emphysema, and other respiratory conditions. They are also used to measure progress in smoking cessation. The main volumes and capacities measured in this test are summarized in the book. Now, there are also health professionals sa ating respiratory. Kagaya sa radiography, meron tayong radiologist technologist. Dito sa respiratory system, meron din tayong mga professionals like the respiratory therapist and the respiratory therapy technician who specialize in evaluating and treating breathing disorders. Respiratory therapist evaluates the severity of the patient's condition by taking complete history and testing respiratory function with specialized equipment. Based on their findings and in consultation with the physician, therapists design and implement individual treatment plans which may include oxygen therapy and chest tissue therapy. Yun nga, kagaya lang din siya, ang bawat respiratory or bawat system in human body, kagaya dito sa respiratory system, meron tayong specific na tao na maangalaga sa atin, which is in the respiratory system nga ay the respiratory therapist.